Hello and welcome. My name is Laura and I'm going to be your dermatologist today. So, what brings you into the office today? Okay, so you are having some concerns with whiteheads and blackheads? Okay, so I'll just bring up your medical history and we'll examine your medical history in detail and then we'll begin the consultation, okay? Okay, so I'm just going to begin with some questions, alright? Okay. So let's bring up your medical history with us here. Okay. So details. Just fill those in. So your first visit with us was August 17th, 2019. And that was your first consultation. And you had some extractions that day. Okay. And your last visit with us was July 28th, 2020. So it's been about a year and a half. You came in with some rashes, contact dermatitis. How's that been since? Okay, and the results came back for your skin patch test with that, and it seems you got the available treatment. So you've been okay with that since? Great, good to hear. Okay. So I'm just going to ask you a few questions now, okay? Okay. Have you ever used prescription skincare products before? Okay. Some of these questions might be relevant to your concerns today and some may not, but we have to ask them. Okay. Do you sunbathe or use a tanning booth? Okay. Do you wear sunscreen outside and in naturally lit interiors in your home or office? Okay. And what SPF do you use? Do you know what sunscreen you use? Okay. And do you cover all of your exposed areas? Okay. And when exposed to the skin, do you find that you tend to burn or tan? Okay. And apart from the whiteheads and blackheads that you are currently experiencing on your skin, do you have any other skincare concerns you'd like to talk about today? I can list them, sure. Acne in general? Okay. Rosacea or redness? Okay. Age spots or hyperpigmentation? Okay. Fine lines or wrinkles? Okay. Loss of firmness? Okay. Dryness? Sensitivity? Okay, and do you know what skin type you have? You're not sure currently? Okay, I'll have a look at that for you in a second. Okay, and what products do you currently use for your skincare routine on your face? Okay, yeah, I'm familiar with that brand. Do you have sensitive skin? Do you tend to react to products? Yeah, okay. And do you know what skincare products you've reacted to before? Okay. And are you currently taking any medications at all? Okay. And do you have any new allergies since your last visit with us? Okay, and that you're aware of. Do you smoke? Okay. And do you consume alcohol? Okay. Alright. So that takes care of the questions, and now we can begin having a look at your skin and we'll have a look at what treatment is best for your skin today, okay? Okay. So I'm first going to begin with putting on a pair of gloves. Now, because it has been some time since your last visit here with us, I also need to have a look at your moles. Because I am a dermatologist, we do have to look for various appearances on the skin that could be of concern, as well as the skin concern that you've come in with today, just to make sure nothing is going to cause you any harm in the future, okay? Okay, so as I look at your skin and touch on your skin gently today, I'll be assessing the texture of your skin type, see if there's anything that I'm concerned about. I'm also going to be looking through your scalp for any spots or cystic acne, as well as moles that may have cropped up since your last visit. I'm going to make a note of any that I see. I'm also going to be having a look at any of your moles from your previous visit, see if they've changed colour, size, things like that. Is that okay with you? Am I okay to do that? Okay. So just feel free now to just sit and relax, okay? I'm going to have a look at your skin now. Okay. Just going to begin by gently patting away, creating a little bit of tension around your scalp. Do you wash your hair regularly, or rather do you find that your hair gets oily? Okay. Okay, just touch down your jaw. So I'm going to have to apply a little bit of cleanser, because I noticed you have a little bit of product on your skin, and I just want to assess your skin as accurately as possible, okay? I'm just going to be using a mild cleanser just to remove any makeup, dirt, debris, build-up, whatever might be on your skin, okay? Okay. It's going to gently brush this down your skin now. This is going to just create a nice, clean canvas for me to work with so that I can accurately have a look at your skin, okay? Just going to be using this on your face. Okay. Down your cheek and nose. Over your forehead. Down this cheek. Nice and gently. Nice and gently. Across your chin. Across your chin. Across your chin. Down your other cheek. And this will dry naturally. I won't need to remove this. You don't have too much product and build up on your skin. This is just going to create a nice even canvas for me to work with so that I don't miss anything, because I want you to get the best available treatment, okay? Okay, down your nose. So look at that, okay. Great. There we go. There we go. There we go. Down, 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 and around. Gently pat around your eyes. Around your mouth. Okay. So that's now given me an even canvas to work with. So let's have a look at your skin again, okay? Okay. So I can see where those white heads and black heads are that are giving you a little bit of trouble. I'm noticing them around your jaw. However, around your do have a little bit of texture. That might be from wearing headphones or the skin not exfoliating properly there. Do you happen to wear over the head headphones at all? Okay. However, other than that, your skin seems to be quite alright. I'm not noticing any other areas of interest today. Okay, so now let's have a look at your scalp, okay? I'm going to be looking through your hair, checking for spots, acne, anything irregular, lesions or moles, okay? Okay. So just I'm working my hands through your scalp now, and I want a nice thorough look just to see that nothing has cropped up. And if it's okay, if it certainly has cropped up, but I just want to make sure that I don't miss anything. I'm just going to take my time going through your hair, okay? Okay, and have a quick look around your ear. Okay, perfect. Okay, that's good. Okay. It's very interesting where signs of moles, melanoma can crop up. You can even get signs of them in your nails. I remember that from your first visit. Excellent. You held on to knowledge very well. So, if that's alright with you, of course, I'm just going to have a quick look at your skin in general, including your hands, okay? Oh, great, thank you. Alright. You're doing very well. So as I'm doing this, are you noticing any itchiness, soreness, redness, anything like that? Okay, there's no flaking or dry skin. I'm not noticing anything so far, which is good. Alright, so now I'm going to have a look down your arms and your exposed skin. Is that okay? Okay. Okay, let's have a look at your nails. It's always good to not wear nail polish to a dermatologist's visit, just because it helps your dermatologist have a look at your nail beds. So that's great that you're not wearing it for the visit today. Let's look at your other arm. Okay. Okay, so I'm noticing a new mole on your left arm, so I'm going to have a look at that, okay? In a bit more detail. Okay, seems to be okay, colour's okay. Doesn't hurt when I touch it at all. Okay, good. Okay. Great. I'll make a note of that. Okay, can we have a look at your neck now? Okay. Nothing here that I can see. Shoulders. Okay. Down your other shoulder. Okay. Just want to have a quick look at your shoulder here, just to make sure. Okay. Okay. And your other one. Okay. Would you mind raising your arm so I can just have a look at your inner arms? Okay, thank you. Okay, excellent. So it would appear that minus the new mole on your left arm, there are no new appearances on your skin, and I don't see any causes for concern outside of the problem you've reported to me today. So I'm just going to make a quick note of that. It's very important to keep a mole medical history so that if anything changes, we can document when I noticed its appearance and if it changes in the future. Just check the size, check the colour. Okay, so going back in now to your face, I just want to see what areas exactly we're going to be treating today, okay? Okay. So I think we're going to take care of the blackheads you have here in between your eyebrow. And it's raised just ever so slightly and branched off into your forehead. And I've noticed you have some blackheads on your chin, so we can definitely treat those. And you have whiteheads here, down on your chin and jawline. Right about there. I think you have some blackheads scattered in with that. So I just want to make sure none of them are inflamed, because if any acne is inflamed, and by that I mean infected, painful to the touch, very sensitive, then you do not want to be treating it at that time with something like a comedone extraction. You want to be working at that with some medications and ointments on the skin first to almost ease into a treatment such as that in the future, because it can be far too harsh on the skin with a comedone extraction on an inflamed acne such as cystic acne. That can leave scarring, and we don't want to do that. So just want to make sure that none of these blackheads or whiteheads are inflamed. Okay. So you seem to have combination skin from what I can tell. Yes, that's pretty typical. It's very easy to put a nice gentle skincare routine together for that too. Do you wear much makeup at all? And do you happen to know if those makeup products are non-comedogenic? You don't know, it's okay. Alright, so let's get into your treatment. So we offer 3 forms of treatment here at our office. We offer a chemical peel, microdermabrasion, or a comedone extraction. So with your first visit here with us back in 2018, you may have familiarized yourself with comedone extraction. That is the treatment I would like to go for today for your skin. The reason being is that you have such small areas of blackheads and whiteheads that I think an overall chemical peel or microdermabrasion on your skin could be too harsh. And I've personally found that with my patients in the past, microdermabrasion can be a little bit underwhelming for the treatment of blackheads and whiteheads. And I find that manually working with your skin can be most effective. Okay, so how did you find the experience of your original comedone extraction? Okay, let me just gently reintroduce you to the tools. They always seem a little bit intimidating, but I promise you, with a good hand such as mine, I will very much be able to take care of your skin nice and gently today. Okay. So here are the tools, all essentially the same tools. Just depends on the size of the extraction I need to make. Now, there are open comedones and closed comedones. An open comedone is a blackhead, which means it's been exposed to the air, and a closed comedone means it has not been exposed to the air or to the surface. And so I'll be using a combination of these tools today to take care of your skin. Here is the most typical tool that tends to be used by dermatologists. So this is the extraction tip here, which is used to almost gently pull away from the surface the open or closed comedone. Now this tip here that you can see is the sharp end, and this can be used to very gently prod at the blackhead or whitehead to allow it to open, and then you will then move on to the other side to extract it properly. I find that I don't need to use the sharp tip of this one pretty much at all. I find that with my method, the blackheads and whiteheads can be removed nice and gently with my warm towel enzyme based treatment. This normally helps to loosen your skin, loosen up the pores, open them up a little bit, and then that tends to make the skin a little bit more malleable, easier to work with. Okay. So, are you comfortable with moving forward today with your comedone extractions? Excellent, okay. So, we have cleansed your skin already. So I'm just going to prepare the treatment for you. So, before we begin, I have to apply a warm enzyme-based treatment onto your face in this towel. And this will again soften the skin, open up your pores, and make your skin a little bit easier to work with. And that will ensure that you go home today with very gently treated skin. Okay? This is a very pleasant and relaxing experience and very hydrating for your skin. So you should find this quite relaxing. Okay. So this will only be on your skin for a minute or so. So I'm just going to place this now on your skin. Okay. Okay. So you can feel free to just relax now as I apply this to your skin. And as I mentioned, this won't take long, so the enzyme treatment will just begin to work on your skin. You can just feel free to relax with this on your skin. Just for a few seconds longer. Okay. Alright. So that is your skin treated with the enzyme treatment. And now we can begin with extracting your whiteheads and blackheads, okay? Okay. So I always treat my tools with an alcohol treatment, and that will keep the tools sterilized every single time that I use it on your skin. It can be time consuming, but it is most certainly worth it to make sure that your skin is not hurt or damaged at all from blackhead removal to blackhead removal or whitehead removal, okay? Okay. So I have my alcohol pads here, and I'm going to be wiping the tool down every single time that I work with your skin, okay? Okay. Okay. So I'm going to start on your forehead, okay? Right about there. Just going to take my time. It's almost a swinging motion with the tool to help remove it from your skin. If you do happen at all to find yourself not being able to resist the urge at home to remove your whiteheads or blackheads, I might suggest a follow-up treatment for you. So what you'll want to do is, after you've accidentally or intentionally removed either the open or the closed comedone, is apply a mild cleanser to the area. Then wash your skin off, pat it dry, and apply a salicylic treatment to the affected area, and that will help prevent further breakouts or an infection or inflammation in the skin, okay? I know it can be very difficult at times to treat blackheads and whiteheads and especially ignore them. So I understand that can be a little bit difficult to do. No, we actually don't offer comedone extractions for all forms of acne. For example, acne that tends to form not in the form of whiteheads and blackheads, such as hormonal acne, for example, we do not treat with comedone extractions. We actually encourage an ointment treatment for that first, and basically this breaks down the acne, whether it's hormonal or otherwise, and then we can begin having a look at more hands-on approaches after that, because when you're working with acne such as that, the skin can be very inflamed and very sensitive. So using tools that can be sharp or pointy, or even just the rounded comedone extractor, can be far too aggressive on the skin, and then that can cause scarring, hyperpigmentation, and then you're fighting another battle at that point. So we tend to take a different route with that type of acne. Yeah. So this is going nice and well. I like that. So what's going to happen today is, after I have removed your blackheads and whiteheads, I'm going to be applying a prescription retinoid to the areas that I have removed the blackheads and whiteheads from, and that is basically an extremely powerful version of vitamin A, and that encourages skin cell production, so it tends to work for post-acne blackhead, whitehead treatment quite well. However, it is a treatment that makes your skin a little bit more susceptible to the sun. Not only that, when exposed to the sun after using a retinoid, your skin can become, the product can be a little bit less efficient on the skin. So what I always suggest is wearing sunscreen immediately after wearing a retinoid on the skin. Otherwise you can cause a little bit of damage to the skin if you leave your skin exposed to the sun with a retinoid. So I'm going to apply a little bit of sunscreen on top of that for you, okay? And I'm going to be sending you home with some different Adapalene, the 0.1% ointment. You can buy this over the counter. You can have higher percentages prescribed to you, but because I find that your whiteheads and blackheads seem to be very easy to work with, I don't think it's necessary to work with anything more than that. And again, the Adapalene Gel is retinoid based, so again, it's best to be using it at night, but even so, I always encourage putting on sunscreen in the morning, even if you've used the retinoid at night, just to make sure that your skin doesn't get harmed at all. Yes, you can use hydroxy acid treatments. However, I have found that they are not the most effective for those who wish to combat whiteheads and blackheads. The only one I tend to recommend is salicylic acid. It tends to be the most effective for blackheads and whiteheads and several other causes and concerns regarding acne. So I would suggest a salicylic acid treatment, yes. How's your skin feeling? Yes, I have very, very gentle hands. And that enzyme treatment works so well because it breaks up the blackheads and whiteheads a little bit for me. It makes your life a little bit easier, and mine too. Great. So there's just a few left now. I've finished on the area just above your nose, the bridge. Just branching up on your forehead now. And then I'm going to move on to your jawline. Benzoyl peroxide. Yes, you can use a benzoyl peroxide treatment for acne and whiteheads and blackheads. However, benzoyl peroxide, I find, whilst it is an effective treatment, it is extremely harsh and drying on the skin, and it does actually have a bleaching agent in it, so if you do choose to use benzoyl peroxide, you may find that you'll have dry, flaky patches in that area. That's pretty normal as a reaction to the peroxide, but you also may find that you may end up bleaching your clothes, your pillowcases, towels, clothes, whatever it is that gets into contact with it. So what I do suggest is, if you do want to use benzoyl peroxide, use it in a wash form, such as a scrub, a cleanser, a wash, anything like that, instead of an ointment. That way you can wash it off, your skin will still receive the treatment it requires, and you won't have to worry about it sitting around and causing your skin to flake and whatnot and bleaching your clothes. Okay, so now, just after this one now, I'm going to be moving down now to your jawline and your chin, and that was the other affected area, okay? Okay. Starting here on your jawline, there's not as many here. How to prevent them? Okay, well, that can depend on a variety of reasons why they crop up. So it can be sun exposure, for example. Sun exposure can cause some forms of blackheads. It can be having build-up and dirt on your skin, because all blackheads and whiteheads are simply just a blocked pore or hair follicle on the skin. So you want to be using non-comedogenic products, and basically that means products that won't clog your pores. And you can find non-comedogenic makeup and skincare, so it might be your skincare routine, it might be makeup you're perhaps wearing, could be a variety of reasons. So if you're not able to find the particular root cause, have a look at the ingredients on your skincare products. Make sure you're washing your pillowcase regularly. Try not to touch your skin too much. Keep things like your phone clean. Little things like that can go a long way in keeping your skin free of several issues. However, sometimes they just like to come back and be stubborn, and so an accurate skincare treatment to combat that can be effective, and that's why I suggest a retinoid, salicylic acid, and sunscreen skincare routine at the minimum. Yeah. I will give you some skincare options at the end of your treatment today, if you're interested in those. I've made sure to avoid any inflamed areas on your skin. How are you doing? You still doing okay? So we're almost done with your extractions. Just a few more to go now. Okay. Great. Okay, perfect. So that is your whiteheads, blackheads removed. So your skin might feel a little bit sore and tender right now, and you might see that it is a little red. It's perfectly normal. It's just your skin reacting to me working with your skin today. That will calm down and subside absolutely by the end of the day. However, I do have a very gentle, cool, refreshing, icy towel that I can use on those areas to keep them nice and cool and gently treat that inflamed, tender area right now, okay? Is that okay? Okay. And this will immediately bring down the swelling on your skin. Gently calm your skin down. It's also very lovely and refreshing. There you go. Just pat that onto your skin. Nice and calming and soothing. Perfect. Okay. So how's your skin feeling now? Much better. Very good. I promise you, any swelling and redness you have will be reduced and be completely gone by the end of the day, okay? Okay. So now I'm going to be applying the Adapalene Gel, or the retinoid, to those affected areas. This will help prevent further breakouts of blackheads and whiteheads to your skin, okay? Okay. I'm also going to be sending you home with the 0.1% of this, okay? This is the exact same percentage of that. A little on my finger. Again, this is retinoid, so make sure that you apply sunscreen if it's during the day. You don't need to at night, of course. As a word of warning, first-time users of retinoids may experience dryness and flaking of the area. This is the weakest percentage that we offer. This is 0.1. So if you find that it is drying or flaking on your skin, use it every other day for a few days, and the drying and flaking should subside. Only use a little in those areas, don't use a lot. and you only need to use it once a day. Again, I suggest once at night for it to work its best without any way of being affected by sun exposure. But I'm just treating this now with that retinoid. Just going to grab a little bit more for your jawline. Okay, perfect. So now your skin has been treated with the retinoid. Again, just watch out for any signs of flaking or drying. It is a perfectly normal reaction. If it does tend to persist for a couple of weeks, we'll stop you using the Adapalene Gel, okay? We'll look at other treatments. Okay, but you should find an almost immediate appearance change in your skin, and you should find that the appearance of blackheads and whiteheads should be greatly reduced with this treatment. Okay, so now I am definitely going to be moving on to applying a little bit of sunscreen for you for when you head out today. I'm going to be applying the Elta Md Uv Sunscreen. This is perfect for oily skin because it contains niacinamide, and it's also a wonderful sunscreen overall. It's a mattifying sunscreen, so if you find that your skin is feeling a little matte, you'll know why. Niacinamide is perfect for oily skin because it helps reduce the amount of oil the skin creates. Okay, alright. So this specifically is the Elta Md UV Clear Sunscreen. I always suggest this. To my patients who are prone to blackheads and whiteheads. Again, this is a non-comedogenic product, so it will not clog your pores, but it will still keep you protected from the sun, okay? Obviously going to be using the sunscreen all over your skin because all of your skin needs to be protected from the sun. I'm also going to be putting this over your ears. We tend to forget about our ears. Perfect. And I'm going to put it down your neck. Okay. This washes off nice and gently as well. Yeah, you only need a mild cleanser for this one. Okay, so that is your comedone extractions complete. So I'd just like to share a little bit of follow-up advice for you to possibly prevent further breakouts of whiteheads and blackheads. So try the retinoid skincare treatment first. Again, you only need to apply this once a day, and keep making sure that you're wearing a sunscreen in the morning and try to reapply it throughout the sunlight hours of the day, even if you're at home and exposed to natural light or at the work office. Make sure the sunscreen you're using for your face is different to the one for your body. Ones for your body do tend to clog your pores, so make sure that you're using one exclusively designed for your face. I do suggest the Elta Md Uv Clear Sunscreen for your face. Make sure, again, you're keeping your skin nice and covered with that, and try to reapply whenever possible after 1 or 2 hours or so. Okay? Make sure you wash your pillowcase 1 to 2 times a week. These breakouts can happen sometimes because of that. Try to use lukewarm water for washing your skin. And try to look for products in your makeup and skincare routine that exclusively say oil-free and non-comedogenic. That way, this should help prevent those pores from being clogged and creating those blackheads and whiteheads or other forms of acne in the future. Okay, so your skin is looking much calmer now from the redness before, and I can see that your whiteheads and blackheads are now gone. Great. Well, is there anything else I can do for you today? Do you have any questions at all? No? Okay. Well, make sure you're sticking to the retinoid and salicylic acid treatment. Make sure you're using an oil-free cleanser. Always make sure your skin is nice and moisturized and protected from the sun. So don't forget the different Adapalene Gel. I'm going to send you home with that today. It's been very nice seeing you here again today at our office. And thank you very much for visiting us today and allowing me to treat your skincare concerns. Take care. Goodbye.